It is 7:20. If you're just joining us this morning, welcome in. I know Dr. Liprie, welcome to you too.
Good morning. Thank you.
This topic, it's a big one.
Yeah.
I know it applies to a lot of families, so happy to be discussing it. We're talking ADHD and ADD, the difference, some symptoms.
Absolutely.
So let's jump right in.
So this is a back to school series that we're doing. And when kids go back to school, you'll see a lot of these traits. This is when these things appear. So it's really important to be on the lookout for these symptoms. The first one I wanted to talk about was ADD, or attention deficit.
And there is a difference, so this is huge.
Yes, oh, absolutely. So the symptoms, as the name implies, these kids have trouble paying attention. They're easily distracted. They're losing books and papers and glasses all the time. They get lost completing tests that are kind of multi-step. Do A, then B, then C. And then they're really not listening, even though you're looking directly at them.
So I'm sure that will set off just fireworks in the back with our producer, because I can do that. She'll be like, but I just said it to you. You looked right at me. It's wild. It's wild how that happens. I don't know.
When I've talked to people that have it bad, they say that there's like a lot of television screens on at the same time, and they're not quite sure which one to focus on.
That is so very true. But that is ADD, so we're now going to touch on ADHD.
Correct, yeah. So ADHD adds that hyperactivity component. These kids are going to have difficulty sitting still.
Right.
They're talking excessively. The thing that I see most is this: they're interrupting or intruding while we're trying to accomplish things.
Makes sense.
Oh, yeah. And then these kids are more accident prone.
Like risk takers, kind of? Okay.
You'll see a lot more car accidents in children with ADHD, young adults rather, just accident prone in general.
Wow. We have about 30 seconds here, so if you want to touch real quick on commonality.
Oh, yeah. So these are just a few of the symptoms. It's important to know that you need a trained professional to really get through this and make the diagnosis. And the treatment plan can be rather complex. There's a lot to this.
And it's never ending. And then at some point you have to do some of that work on your own too, right?
Absolutely.
Okay, well listen, when we come back, we're going to talk more about ADD and ADHD, the differences, and how you can treat it, how you can help it.